Yeah,
Hi, Dhwani.
I'm so sorry. I don't know
No,
what.
no, no, that's okay. It's completely something technical, not our fault. So,
Yeah.
a very warm welcome to all the mothers joining in. Let's begin our show again. So, as I said earlier, also, there are a lot of issues in our life which we do not always openly like to discuss, or we are free to talk about it. We are so much biased about our decisions, our fear, coming to a doctor, asking what to do. One of the topics is planned and unplanned pregnancy. Many of the women fear to talk about that. And whereas some of the women are very strong, they know what will be the outset, they know what they have to decide, they have to go ahead. But there is also a group of women who faces many tension, fear, confusion, so many mixed emotion which comes up along with pregnancy. How to go ahead? Should we continue? It's unplanned. Maybe it is planned, but we don't know what to do about it. So it's always better to take guidance. As unplanned pregnancy can raise many of the questions, confusions, thoughts. At the same time, planned pregnancy needs a lot of guidance. So today we have with us one of our experts, Dr. Dhwani Mago from Delhi. She holds an experience of 13 years. Her expertise is in high risk pregnancy and infertility management. Not only this, she is famous among her clients for educating them, for creating awareness around health and healthcare needs. Recently, she got awarded with Women Health Icon Award from Indian Society of Artificial Reproduction. A very warm welcome, Dr. Dhwani, on our platform today to discuss and to create more awareness around planned and unplanned pregnancy.
Yeah, thank you so much. And I'm really looking forward to the questions. And I just want to say that you guys are doing a great job. Nutrizoe
Thank
is doing
you, thank
a
you.
job. And I think most of the mothers who've tried your products are very happy with it. So I must say that you're doing a very good job. Yeah.
Thank you so much. So begin our show today. Uh, First, can you make us understand exactly what is planned pregnancy and what is unplanned pregnancy?
Yeah, so see, what is a planned pregnancy? When a couple decides that now they are, settled in their life and in their careers, and they want to go plan a baby. And that is the time, when we advise couples to come to us at least 3 months prior for a preconceptual counseling. So, what is a preconceptual counseling? That is the time when we can optimize any problems or any difficulties in the mother. If she's suffering from any chronic illnesses, say diabetes or hypertension, or any lupus disorders, or so we. This is the time that we detect any deficiencies in the partners. So, and we can optimize it. We can correct the deficiencies, and we start with some prenatal vitamins. So, when you plan a pregnancy like that, and you go ahead, that's what is a planned pregnancy.
Right.
And in case of an unplanned pregnancy, definitely it happens suddenly. You're not aware of it, or there could be a contraception failure, A lot of girls are not aware of their fertile days and they land up in pregnancies. So that's what we call an unplanned pregnancy.
So, in your the entire years of 13 good years, the experience that you hold, how common is unplanned pregnancy?
So according to the statistics, almost in India, 20% of the pregnancies are unplanned pregnancies.
How,
So you could say 20 out of 120 women do land up in unplanned pregnancies.
so, if a patient comes to you with an unplanned pregnancy, what will be your guidance to them? Is there any timeline for taking the decision?
So, see, the decision definitely depends on the couple, where they stand at that moment. If they are ready to have the baby, that is their personal decisions. Yes, I do guide women that, yeah, there is a for women, the fertile age of the women is very short compared to men. So, because after 35 years, your fertility starts declining drastically. So, that is the time when you need to take, immediate measures. But if you have time, some women come to me at around, say, 30, 32. So, I do advise that, yes, definitely you should go ahead and continue with the pregnancy because after 30 years also, we see an increase in chromosomal abnormalities in the children. So that is another reason that, yeah, you must plan your pregnancies on time. Or if you are for whatever reason you want to delay the pregnancy, you go ahead and freeze your eggs. And then you can have it whenever you want later in life.
Right, right.
So yeah, the
So,
timeline
the
is very.
timeline, what's the timeline for unplanned pregnancies?
See, for unplanned pregnancies, like if a couple they don't want to go ahead with it, so there are two ways, to deal with it. Either you go with a medical abortion or you go with a surgical abortion. So a medical abortion can happen till the woman is 7 weeks pregnant. So till 7 weeks, we can safely give pills to the woman, and she can have a safe abortion. But if the pregnancy goes beyond 7 weeks, then there is a high failure rate of medical of the pills. So we advise surgical intervention, and a DNC is done generally. So yeah, so women need to keep that in mind that 7 weeks is a safe time to take pills till
So, you
7 weeks.
just use the term safe abortion. What is safe abortion?
Safe abortion is something that it's done in a MTP registered center. It's done by a doctor, and because see, a lot of times it happens that a lot of women they just buy the pills over the counter and they have it, but they don't know the correct way of having it or the correct dose of having it. And there are many times that there is a failure of these pills. Either your pregnancy is continued, or you could have an incomplete abortion. So that is when women land up in infections and in continuous bleeding. They are bleeding for almost 20 days or 30 days. And that's when they come to us that, this is doctor, we had taken the pill and, we are still bleeding. So there are chances of retained products of conception. So if you have a safe abortion in a NTP registered center and you follow the guidance of the doctor, so that is what is advised, and not to take over the counter pills.
Okay. So, Dhwani, help me understand now. Suppose if it's an unplanned pregnancy, now I'm pregnant and I want to keep it. So, what is that you guide a lady that how to embrace unplanned pregnancy? What should be their next step?
So see, you need to be mentally prepared that yeah, now you're going to be a mother, and there are going to be changes in your lifestyle, in your day-to-day work. And the first thing that I tell them that now that you're pregnant and you want to continue, so you must visit a doctor at say about around the 6th week of your pregnancy. So generally, you miss your periods, and the minute you miss your period, you do a urine pregnancy test. You get these kits in the market. So you go
Right.
ahead, urine pregnancy test, and once it's positive, so you speak to your doctor that now, doctor, what is the next step? So we call them in. We just do a general blood work so that we check that everything is fine in the mother. And we start with some vitamins for them, basic medications. We take their history, if anything is out of untoward, or if she's having some medical illnesses or some chronic disorders. So we need to keep all those in mind and how to deal with them in this pregnancy.
Right, right.
And then ultrasound is advised at around 6 weeks, 6 to 7 weeks, to locate where the pregnancy is.
Okay.
So that's another thing that's very important, because there are many times that the pregnancy could be in the tube. So, it's called an ectopic pregnancy or a tubal pregnancy. So we always locate where the pregnancy is around the 6th or 7th week, and that is the time when you start getting the baby's heartbeat as well. So, and that is called a viable pregnancy. Once the heartbeat comes, so that is when we call it a viable pregnancy. And that means it's, you can continue and everything is good. So, yeah, that is what's done.
So this is all what we discussed was about unplanned pregnancy. Now let's move on to the second part of our discussion, which is planned pregnancy. So guide us, how do we plan a pregnancy? When should we decide that, okay, we have to plan a pregnancy, and what should be our first step towards it?
So, like I said, that, if you are nearing your, say, you're in your early 30s or in your late 20s, that is a good time to plan your pregnancy. And in case you don't want to, you want to delay, so then you must go ahead and freeze your eggs. Now, if you plan that now you're ready, you want to go ahead with your pregnancy, so you go and meet your doctor 3 months prior. You get yourself checked. You start up with your prenatal vitamins. The folic acid has to be started 3 months prior, and get your blood work done, so that we rule out any, like I explained, any disorders or any blood disorders like thalassemias also need to be checked at this time. And then I advise them about the fertile period. So we give them some medicines, and we tell them that now these are your fertile days. From it's mainly from day 13 to day 17 are your fertile days, and that is the time when you have contact and you are going to conceive. So that's very important to have the knowledge of your fertile days. So because that's how you're going to conceive. And yeah, so we do advise them about do's and don'ts. Now that you're going to plan, you must stop your smoking, your alcohol. You must start taking some antioxidants during this time. Be active, have a healthy diet. It's very important. A healthy diet with a high, good, high protein diet is very important for pregnancy. And also, decrease your intake of tea and coffee, and drink plenty of water. Yeah. So all these things, yeah, you need to keep in mind.
Okay, so Dhwani, as we all know, being a women, that contraceptive is something which plays a big role. So would you like to throw some light on these pills that are available in the market, OTC, and how safe they are?
So the eye pill, right? You're talking about the eye pill?
Yes. Role of
Yeah.
eye pill as a contraceptive pill is my next question.
Yeah. So eye pill, you have to understand that it's not a regular contraception. It is an emergency contraception. So it can be used only in cases of emergency, because eye pill is something which disrupts your menstrual cycle for a while, almost about a month. So your menstrual cycle is disrupted. So that's the side effect of taking an eye pill. So that is why it is not recommended to take it regularly. So you must do a regular form of contraception, which could be a regular oral contraceptive pills, or barriers, or you could go for or implants. So another problem with the eye pill is, like I explained, the failure rate. So a lot of people feel that, oh, doctor, how did I land up in a pregnancy? I took the eye pill. So you have to understand it has a 10% failure rate, the eye pill. So that is how you win unwanted pregnancies.
Right. So you
So
just mentioned few of the contraceptive pills that are available OTC. So like Mala D and all these, which generally women goes for a 28-day
yeah,
course, right? How safe they are, and
yes,
before
correct.
popping those
Yeah.
pills, should we connect to a gynac? or should we just buy and have it?
No, definitely, you must speak to your doctor before buying these pills because there are a number of pills available in the market, and some are high dose, some are low dose, some are for PCOD. So they have different, indications. So it is always advisable that because the doctor would give you whatever suits you. So that is very important that you must meet your gynae before start oral contraceptives. And also we have to take some basic history of the patients because in certain conditions these OC pills are contraindicated. You cannot take them. Say if you're suffering from hypertension or you have a history of some clot in your body or some malignancy in these cases, or you're suffering from any kind of malignancy, you're not supposed to take these pills. So that is the reason that you must always meet your doctor before you take these.
Right. So, as I am done with the portion of questions which I prepared, but at the same time, I knew that you love creating awareness around healthcare topics. So there are many myths which I read around this topic. I would love to take them one by one because some of them are really doesn't make any sense to me at least. But I know there are so many people who blindly follow these myths. Speaking about the first one is only irresponsible teenagers have unplanned pregnancies. Is that true or false?
Uh, Unplanned pregnancies can happen at any stage in your life. So I've had patients ranging
Right.
from 18 years till say 45 years. That is not really true. So, and unplanned pregnancy can happen with anybody, and that is the reason that your cycles should be regular, and you should know your fertile days to avoid that.
Right. The next one that is there is you're always in control of when you get pregnant.
Sorry, always.
You are always in control of when you get pregnant.
Well, mostly you are, but but like I said, that even contraceptives have a failure rate. So that's not in your hand. If something like I've seen cases. I mean, women conceive even after a tubal ligation, even after blocking your tubes. So if that could have a failure rate, so although it's very less, but yeah, it's not
Right.
like I said. No contraception is 100%.
So as we are talking about contraceptive pills, the next one is I can use the morning after pill for regular contraceptive.
No, not at all. Like I explained that not at all. It will lead to many complications. I just had a patient who had taken an eye pill and been suffering from bleeding for the last 1 month. So that is one major complication that your cycle will get disrupted after taking the eye pill. So do not take it regularly. Only if there's been a mishap, like if the bag has ruptured or the condom has come off or something like that. So that is when you take the eye pill. But otherwise, if you are sexually active, you must go on oral contraceptive pills or any regular method of contraception.
So the next one is if you're virgin, it's your first time, you'll never get pregnant.
No, that is no way. That's not true. You can get
I
pregnant.
told you there are few of them which even I didn't found any sense, but trust me, when you see on Google and you find out these are the most common myths. People
Yeah.
really believe into it that if you're a virgin, it's your first time, you will never get pregnant, which is not
No, no,
true.
not. It's your fertile period. You will definitely get pregnant. I mean,
So the next one is if you track your cycle every month, you do not need hormonal birth controls or condoms.
so sometimes, a lot of girls have delayed periods because of PCOD or their cycles are shorter than normal. So that is the time, when nowadays, girls have these apps, they have these
Right.
menstruation apps tell them that this is your fertile period now. So they generally, follow that. But sometimes if your cycles are not regular, then there could be an issue that, the days could be little 1 or 2 days up down. So if it's say a 5-day cycle, then your fertile period will get delayed. Then it will be somewhere around day 15 till day 20. So there are changes. So that's why this is correct.
No, the question was if I know my cycle exactly and I track my cycle, I do not need to use any of the birth control measures. Stay with us. I think again there's a network issue. She'll be back soon. Hi
Better.
Ashika. Hi everyone. If you have any questions, please feel free to put your questions in the comment box. We'll take them one by one.
You can still hear.
Yeah, Dhwani, again, I think the network just went. Yeah, better.
Yeah, sorry. Tell me.
That's good. So the question was that if I can track my cycle, I do not need contraceptives or any birth control measures.
No, that's what I said. That you are tracking your cycles, but there are
Okay.
times when you might just ovulate a little earlier or a little late. So
Right.
that is the reason that yeah, you must practice contraception. And
Okay.
also a benefit of practicing contraception like barriers is that you are protected from any kind of STDs, sexually transmitted diseases or HPV
Correct.
infections. So that is another benefit that, yeah, you must always make sure that you practice barriers.
So the next one that is coming up is emergency contraception is basically same as abortion.
No, no, no way. Emergency contraception is not same as abortion. Emergency contraception is basically, it's a high dose of progesterone that we give so that your pregnancy, in case you conceive, it doesn't get implanted in the uterus. So that
Right.
is how it prevents the pregnancy. But in case if for whatever reason you still conceive after the I pill or after the emergency contraception, you will have to go ahead with an MTP or a medical way of abortion. So they are two very different things.
Right, right.
Yeah.
So next one coming up is, and it's one of very common, which I also asked in few of my sessions, but I would love to take that question again. Is you cannot get pregnant if you're breastfeeding.
So again, there is something called as lactational amenorrhea. That's when when you're breastfeeding very regularly, you don't have your periods. So mostly, or there'll be ovulatory cycle. But again, like I tell all my patients, this is the time when you need to pull. You need to practice contraception because you may land up in a pregnancy. Although you are not having your periods,
Right,
but you may land up in a pregnancy without having periods as well. So there have been cases, that they've been breastfeeding and you conceive again and you don't get to know. So contraception is a must during that period. Yeah.
Right. So the last one is, can I get pregnant even after using IPIL? You already have answered, but I would like to take this again.
You
So,
can.
so
Almost
Dhwani,
10%.
yeah.
So you be very good. Yeah.
No, you were saying something for the IPIL this thing. So is it
I
possible to get pregnant, right?
It has a 10% failure rate. So in spite of taking I pill, you need to be, sure that you get your period on time. And in case you miss your period, then you must go ahead and get a pregnancy test done.
Right. So these were collection of myths which I got from somewhere, and some of the mothers asked us to put it to you. I would love if you will share. You could share one or two which you have been through with the mothers, and which are absolute myths.
Absolute
Um,
myth. There are so many myths, there are multiple myths. So,
what's the most common one which you get to your like from patients coming in?
so I get the myths about, it's not a myth, but yeah, if you can eat papayas and pineapples in your pregnancy. So generally, I do advise that, yeah, these foods are a little inflammatory. So, although there is no scientific reason, to prove it, but I do tell them that, yeah, if it's your tradition says it, you do go ahead. So certain, I tell them that if it's traditional, if it's in your family, you do go ahead and follow it. But otherwise, there is no scientific reason based behind that. And also, there are a lot of, period myths, like, a lot of women, they avoid eating pickles during periods. They don't wash their hair. Actually, especially after delivery, like I've noticed that women don't take their baths. They say that, we have to wait, there is the wound minded. So there is, I feel that that's something which we don't really advise. You can, and nowadays we give these waterproof dresses, so it's absolutely safe to go ahead and take your bath
Right, right, right.
during your periods. Nothing like, you don't have to wash your hair or anything, something.
So there are many myths, there are many facts around the topic
Yeah.
as we discussed about planned and unplanned pregnancy also today with Dr. Dhwani. So all the mothers who are listening to us, all the people who have joined us today, for both the things, as Dr. advised, it's very important to take guidance through your gynac. Before popping a pill, before going for abortion, before planning a pregnancy, if you have an unplanned pregnancy, how to go ahead with it, everything you can openly come and discuss with your doctors. And you should. That is how you get a correct direction.
Yeah,
Thank you.
absolutely.
Thank you. Yes,
And
yes.
that, it is always very important to be knowledgeable and, know about your body. You must know your fertile days, know what kind of contraception options you have, be well informed.
Right.
So that, yeah, so you're not scared. Even if you land up in an unplanned pregnancy, don't be scared. So because I've seen so many young girls, they're so scared. So be knowledgeable. You should know your fertile days, practice contraception, and be in touch.
Yes. So thank you so much, Dhani, for taking out your time for sharing so many knowledgeable answers, queries, taking up myths, and creating so much awareness around these two very, very rarely spoken topics, which women actually feel that how to say or how to
Right.
discuss openly.
Yeah. Yeah.
Thank you so much.
Thank you for having me. It was lovely and always here to answer questions.
Yes. So, any of the mommies, if you have any of the questions, do share with us. We would take those questions to Dr. Dhwani and make sure that you get a proper answer of your questions. Thank you. Thank you so much for joining us today. Thank you once again, Dr. Dhwani.
Thank you. Take care.
Take
Bye-bye.
care. Bye.